Good evening, everyone. Good morning, everyone. Good afternoon, everyone. Depending on where you are watching us from, you are welcome once more to Dr. Ephraim YouTube channel, where we talk about the eye, where we propagate the gospel to help our eye to see better, where we talk about things that will help us to fight blindness in our environment, in our community. Today, we have come with a very interesting topic. The topic that is causing trouble, that is causing commotion, that is causing confusion everywhere. We have come to discuss something very interesting. We have come to talk about a very big disease of the eye that is affecting everybody. Mostly us that are in Africa, mostly us that are Negroes that have black eyes, black iris. Today we are going to talk about glaucoma. We call it glaucoma. Some of my patients, we call it glaucoma, depending on whatever you call it. Countryman go call and wait glaucoma. So we are going to talk about it. We want to talk. It's a very long topic. It's a very long discussion. But we'll try to break it down in a smaller bit. So if you are interested to know more about glaucoma, to know how you can manage it, how you can prevent it, how you can make the eye function even with glaucoma, I will advise you to draw closer and listen to this, our YouTube channel. Countryman, if you are interested, if you know, say you want to know many things about glaucoma, as you go make your eye, make glaucoma no chop am, make glaucoma no destroy am, make you come closer, carry your chair, come close, make you listen to what you go carry come. Glaucoma is a blinding disease of the eye. Its blindness is irreversible. The blindness caused by glaucoma is irreversible. That's why the definition of glaucoma, they call it a progressive degeneration of the eye. It comes gradually. In definition, we say it's a progressive optic neuropathy in which raised intraocular pressure is a risk factor. Raised intraocular pressure is a risk factor in the cause of glaucoma. So there are a lot of people that live with glaucoma, but they are not aware because it's a painless disease and it takes one eye at a time. That's why it's called the theft of sight. Glaucoma is called the theft of sight because it takes one eye at a time. Most patients come to the clinic when they are blind in one eye already and they are managing the other eye that the glaucoma is about taking. So it's advisable to do routine eye examination to take care of this disease that is called glaucoma. Why I brought this topic up, glaucoma, because it's a common problem with the blacks, with the Negroes. People that have black iris is a common disease. It's not common among Caucasians, but it's common among black Africans, common among blacks that are settled in the tropics. So we are going to discuss this glaucoma explicitly. Glaucoma is caused by one, increase in intraocular pressure. When there is a raised intraocular pressure, you will see the eye being affected by glaucoma. What is actually this glaucoma? Let me explain it. We are not in the academic section now, so I want to explain it the way the layman will understand it. The human eye has this shape, just as I explained before. There is a nerve here that is called the optic nerve that connects the brain. Normally, the eye is the offshoot of the brain. The human eye is like the brain. It's just the impulses from the eye that is taken to the brain for us to see. Once there is a disconnection from the eye to the brain, that person will not see. The eye will be like a toy. That's why the first way to catch a glaucoma patient is by their gaze. We call it gaze. We call it glaucoma gaze. The way they look. The way a glaucoma patient look will determine whether the person is having glaucoma or not. They see them opening their eye wide open for them to see. It's because the impulses that is going to the brain has been cut off by glaucoma from the optic nerve head. Now, what is the cause of that raised intraocular pressure? What is making the pressure to build up in the eye? There is a fluid that is produced in the eye. Is called the aqueous humor. Aqueous humor is the water inside the eye. When you look at this eye now, this structure of the eye, you can see that there is a cornea in front here, and there is a chamber immediately after the cornea. It's called the anterior chamber. It's like the parlor, when you have room and parlor. Then when you come in front of the lens, behind the iris, you will now see the posterior chamber. These two chambers are filled with that fluid that is called the aqueous humor. The aqueous humor. There are two waters that you can see inside the eye. There is one in front that is called the aqueous humor. There is this one that is like a ball that you see here. It's called the vitreous humor. But the one that has something to do with this glaucoma that we are talking about is the aqueous humor, which is produced by the muscles of the iris, muscles of the ciliary body. We call it the pigmented epithelium. It releases this aqueous humor, and the aqueous humor will pass through the pupil to be drained out through the anterior chamber. That chamber has what is called the trabecular meshwork. The trabecular meshwork is like a sieve, like a grater, where the fluid will pass into the sclem canal. The sclem canal connects into the system. Once there is interruption in this flow of this aqueous humor, there will be build-up of the intraocular pressure. How can this be interfered? Number one, when the aqueous humor is being produced by the ciliary body in excess, in such a way that it cannot flow, before it flows out of the sclem canal through the trabecular meshwork, more fluid are accumulated in the eye, the pressure will build up. Or if there is a blockage, if the drainage ability of that trabecular meshwork is not fast enough, the fluid will be built up. Then there is a problem with production. There is a problem with the ability to drain. So the accumulation of this aqueous humor, this fluid that is in front of the eye, is what causes back pressure. When the pressure builds up in front of the eye, it causes back pressure. This back pressure hits the optic nerve head, and it causes what we call excavation of the optic nerve. So this excavation of the optic nerve gives rise to the death of the ganglion cells and cutting off the impulses that gets to the brain. When these impulses are cut off, you will now see that there is a demarcation between the eye and the brain. Just like cutting off the power source of the bulb will now become useless. It will not be able to see because you have cut off the wire. The wire looks like the optic nerve that connect to the light source. And that light source is what? Our brain, that which I've told you that is the brain that actually sees. So when the optic nerve is destroyed by this build-up of pressure, you have what is called glaucoma. You have what is called glaucoma. So glaucoma result as a result of what? Build of intraocular pressure. Intraocular pressure means that the pressure inside the eye is too much, that it affects the optic nerve head. Then when we talk about fluid in the eye, some patients will think that it's tears. When they come sometime and they have glaucoma, and you're talking to them, say, doctor, that when my papa died, I cry where I cry. Now that cry, why I cry? Now it make the pressure come increase. No. The tears is different from the aqueous humor. The tears is on the eyelid, is on the gland close to the eyelid. That is called what? The lacrimal gland that secretes the tears. But the fluid I'm talking about is inside the eye, at this part of the eye that I call the room and the parlor. The anterior and the posterior chamber is where that fluid is located. In front of this, our white eye, the fluid is there. Not the one on the surface that the tears produce from the close to the eyelid. So the tears is not the fluid I'm talking about. The fluid I'm talking about is inside the eye. That's a fluid that normally flows out when the eye is punctured. It drains out, and then the pressure of the eye will drop. So raised intraocular pressure is one of the risk factors of glaucoma. So once the pressure buildup is high, that patient will start having problems. The thing starts with what we call ocular hypertension. From ocular hypertension, it will now lead to what? Glaucoma. So glaucoma is a blinding disease that can destroy the eye. And the danger with glaucoma is that the blindness from glaucoma is irreversible. Glaucoma is irreversible. It's a disease that cannot be reversed. Once it hits the eye, the blindness comes, it cannot be reversed. So glaucoma causes blindness. It's gradually causes the eye to go blind. Then I want to introduce two types of this glaucoma that is common in our environment. The most common one is what we call primary open angle glaucoma. Primary open angle glaucoma, just as the name sounds, the angle is open. This angle I talk about, the angle that the fluid flows out to enter the sclem canal. When that angle is closed, when that angle is open, but the ability of the sclem canal to drain the fluid into the ability of the trabecular meshwork to drain the fluid into the sclem canal is reduced, pressure will build up to cause glaucoma. So that is open angle, is the common type that we have in the environment. The blindness from open angle comes gradually. It comes gradually until it destroys the eye completely. Then the second one is called primary angle closure glaucoma. For angle closure, it's an emergency. It's not common in our environment. When that one comes, you see a lot of signs: hazy cornea, redness, photophobia, pain, headache. So that one causes blindness instantly. That one is an emergency case in the clinic where the patient is taken care of immediately. Surgery can be imminent when that one occurs. But for primary open angle, it comes gradually. So glaucoma is a blinding disease that when the blindness comes, is irreversible. Patients normally mistake glaucoma for cataract. Glaucoma and cataract are not the same thing. Cataract is an aging process. When cataract occurs and you do surgery, the patient can still see. But when glaucoma occurs and you are doing surgery to reduce the pressure. You normally reduce the vision after glaucoma surgery sometimes. But for cataract surgery, the vision becomes clear when you remove the cataract. Then patient used to mistake pterygium for glaucoma. That tissue that grows on the surface of the eye is not glaucoma. Glaucoma is pressure build, is hypertension of the eye. A layman word, you can call it the hypertension of the eye. When the pressure build up, it can destroy the eye. For human being, it will cause stroke. But for us in the eye care, glaucoma causes blindness. The stroke that will affect the eye is that blindness of the eye. Normally, every human being is going blind as you are getting old. Because as you are growing old, your organs are shutting down. Atrophy is taking place. Your eyes are shutting down. They are dimming down. They are going blind gradually. But glaucoma, when it comes to the eye, it hastens this ability of the eye to go blind. That's why we are talking about it, because 90% of the blind patients that I see in this my clinic is caused by glaucoma. Then, glaucoma blindness is not the end of the world. That's why we tag that glaucoma patient can still function normally in the environment, even when the patient is visually impaired. Because when you talk about the 5 senses in the body, the eye is just one of the senses. When one of the senses is taken off, that's the eye, the remaining 4 senses, the sense of taste, the sense of touch, the sense of hear, can come together to still help the patients. That's why when you come for rehabilitation, we try to act. Other tests that you can do to help a glaucoma patient, like our low vision assessment. During low vision assessment, we try to activate the other senses during rehabilitation and then introduce some gadgets that are different from the conventional clinical gadgets that we use, like lenses and all those things, to help the patients. So, but we are going to discuss this one explicitly in our next video. But to help our countryman and countrywoman, may they understand this topic where we talk. Because say we don't talk a lot of grammar. We don't speak big English. Now, I want break and down, make countryman understand what way we talk. Make countryman understand what way we talk. What way we carry come today, now glaucoma that they call them. Glaucoma, countryman go call am glaucoma. Anything where you call am, na so na it be. Now one disease where they blind our eye, it dey make patient make e no see. And the blindness wey this glaucoma dey cause, doctor no dey fit treat am. They no dey fit treat am. If you treat am, the eye go blind, go still go blind. But if you discover am on time, if you notice say you get glaucoma on time, you don save the eye from going blind. The eye be like tire. When air don enter am inside, the pressure of the tire go increase. And as you dey drive that motor, the tire fit burst. But when pressure for eye don increase, the eye no go burst, but e go come cut the wire wey dey for back of the eye wey we dey take see. Na that wire na im we dey call optic nerve for grammar, for big English. Na im dem dey call optic nerve. Then na wire wey dey for the eye wey connect the brain. When this glaucoma don chop that wire comot, the eye go come be like ordinary toy. E no go dey see again. So countryman, countrywoman, the only way wey you go prevent this glaucoma make e no blind your eye, na say you go run dey come clinic dey check your eye. Glaucoma no dey show for eye o. Glaucoma no dey pain for eye. Glaucoma no dey scratch for eye. Glaucoma no dey comot water for eye. The eye go just dey okay, but na only say inside the eye go dey go blind small small. Na im make am say make you come, make you run go clinic, make you dey check your eye. The doctor go check the pressure of your eye, just the way they dey check pressure for tire, make the tire no burst. Na so they go check pressure for your eye, make glaucoma no chop that your eye comot. This glaucoma, e dey around us. No be oyibo person disease, na common disease between my countryman and countrywoman wey e dey around us. If we manage this glaucoma very well, you fit carry the eye wey God give you with glaucoma until God go call you. But if you no manage am, na im be say countryman, countrywoman go come take walking stick for blind people, come take am dey waka, or person go come dey hold you for hand, you go dey waka dey go where you dey go. Na this glaucoma be number one thing wey I don see for inside this my obodo Nigeria, wey dey cause blindness. And our people no dey know. Na only when the eye don blind, na im dey come for clinic. Na im make am I dey shout, say countryman, wherever you dey, make you run go clinic, make you screen your eye, make you check your eye for glaucoma. When glaucoma enter the eye, as the eye be like this, you see this wire wey dey back, wey dey connect the brain, e go cut am. As glaucoma cut am like this, you no go see again. The eye don go blind patapata. No doctor go fit help you. No, na only God fit make the eye see again. But if you carry and catch am on time, na im be say you don save the eye. And people wey don get glaucoma already, make una no cry. Make una no say the God don kill us finish. There's still hope. There is still hope. Hope still dey for una. That hope wey dey for una na because say we get 5 senses. Na senses they call am. As you dey hear, as you when person touch you, as you dey taste something, all those senses wey you get for your body, the remaining 5 senses, you go fit still take am function. When we do low vision rehabilitation, we go bring some other things wey go help you make you function for office. No go resign your work because say you get glaucoma. Make you find low vision specialist. That low vision specialist, just the way I dey do am for them here. Me wey be low vision specialist, na so I dey take help those glaucoma patients by giving them many things. Some fit carry CCTV, some fit carry pebble, some fit carry hand magnifier, some fit carry spectacle magnifier. They go take am dey do their work, dey continue dey jolly their life dey go. Some we go teach am as they go take the waka, wey na mobility expert go do am. You go fit waka from your house go toilet, cook for your kitchen. They go teach you all these things. They go teach you wetin wey we dey call braille. Braille na book wey person wey don go blind dey take read. We go teach you how to use computer too, make you start dey see very well. So countryman, countrywoman, if glaucoma don blind your eye, no be death sen ten ce. No go commit suicide o. No go die. No say God don kill me. Na only one of your senses don go. We go still help you. So glaucoma, to prevent am, make you run come clinic, come check your eye. This glaucoma get 2 types. E get the one wey be emergency, wey dem dey call close angle. E get the one wey be open angle. Na that one dey common for our society. So now, so we dey beg countryman and countrywoman, make una go check una eye for glaucoma. As we don carry this glaucoma come, na the introduction we don do o. We go still discuss many things concerning this glaucoma. So if you wan hear about this glaucoma very well, make you subscribe for this channel. Press subscribe button, Make you like am, make you comment, ask your question. I go answer you from the other end. As you like this channel, make you share am, make other people hear, so that our people no go dey go blind. Make una thank you, say una lis ten to this channel. Thank you for listening to this channel. Thank you. Give us thumb up, subscribe, and share, and then hit the notification button so that whenever we upload new videos, you'll be the first to get in touch with it. Thank you for listening. God bless you. Comment, and we are going to respond to your comments. Thank you.